Our next presenter, this is going to be a very, very interesting presentation because it's ever pressing in the sports industry today. And that is, should you allow your child to play football? Very interesting concepts, because even before all these studies came out, people questioned that because of the danger of the game, but it's a great game. And Dr. Joseph Maroon is a senior vice president of the American Academy of Anti-Aging Medicine, and is a board-certified professor and vice chairman of the neurological surgery at the University of Pittsburgh School of Medicine and the Hendel School of Neuroscience. With more than 250 published scientific papers, Dr. Maroon's clinical and research interests have been in the area and development of minimally invasive surgical procedures for the brain and spine. In speaking with Dr. Maroon, he shared with me that he was a scholastic All-American in football in Indiana University. He is the team neurosurgeon for Pittsburgh Steelers for 25 years and is the NFL Head and Neck Committee. He's on the NFL Head and Neck Committee for the prevention of all of these concussions that you see all the time. He's a professor of neurosurgery at the University of Pittsburgh, and he has also participated in 8 Ironman triumphs in the last 15 years, and participated last month in the World Championships in Hawaii. With all these wonderful things, I asked one question to Dr. Maroon. Understand, I'm from Miami, and we have the Miami Dolphins, and I want to know, with 6 laterals and no time, how come you didn't keep the guy in bounds to win the game?
That's a great question.
It's my pleasure to introduce Dr. Maroon.
Thank you. Thank you, Carl. Thank you. Thank you. Well, it's a great pleasure for me to be here again with you this year and to share some of the things that I've been involved with over the years, particularly in concussion and concussion management. I suspect that very few of you have to make the decision, should I let my son play football? However, you, I'm sure, do confront in your practice, maybe personally, concussions. And what I'm going to share with you are the risks and the benefits of football participation, and also concussion management. What's the current state of the art in terms of concussions, concussion management, and a little bit about the pathophysiology of concussions as well. As you know, it's virtually impossible on a daily basis not to read about the concussion crisis, the most dangerous game, football, purportedly, the NFL lawsuit by 4,000 former NFL players that resulted in a $700+ million settlement. And we also hear things like this from the White House: unless brutality and danger to the lives of players is reduced materially, the sport is practically doomed. And players suffer grave on-field injuries, and medical doctors prescribe euthanasia for football, and politicians make a federal case out of the game. And I can talk to that. I testified in 2 congressional committees on football a few years back. Never before has a football season ended amid such a universal chorus of denunciation of the game. Football is a grave menace that merits immediate abolition. How many in here, before I continue, would allow your son to play football? I see one hand go up. Would anybody allow their son to play football? Well, I'm not going to take a position on this. I obviously have a bias that I'll share with you as we go along. But these words were said in 1905. And this was when there were approximately 29 deaths from football that year, and there was a presidential commission called by Theodore Roosevelt to investigate the fatalities and the brutality of the game in 1905. And what came of that was the formation of the NCAA. New rules, officials were introduced, helmets and padding were required, and the carnage that you see here